a lot of people have a lot more anxieties about Omicron because it is more transmissible. And it's important to remember that the same things, the same public health guidance that we've used to protect ourselves so far in the pandemic will still apply with a couple tweaks specifically for Omicron. I like to think of preventing COVID-19 transmission as like bundling up for a winter walk. So it's not all or nothing. You can think about these things in layers. So the first would be reducing your risk of exposure. So if at all possible, if you can work from home where you can, reduce the need to go out into public if you don't have to, or reduce the number of social contacts you have during this time, during this wave, that will help. The second thing is ventilation. So if you do have to go out and be around other people, be out in public, how can we improve ventilation? As we know that that's really important to preventing spread of COVID-19. So can you do outdoor activities if you need to meet up with other people? Or how can we improve ventilation indoors, like keeping a window or a door open? Or that's where workplaces will think about maybe some HEPA filters. The other thing is considering upgrading your mask. So earlier in the pandemic, we were recommending any kind of face covering, including a cloth mask. But with Omicron, it really does look like that's not going to suffice. So if you can upgrade to a good quality surgical mask, or if you have access to a KN95 or N95 mask, especially if you have to be around other people for prolonged periods of time, that will be helpful. And then the last layer of protection is vaccination. So we know that our vaccines do help to prevent from severe illness, especially illness that requires hospitalization or ICU admission, and also helps to prevent against death from COVID-19. And the vaccines are widely available now. So that's the last and arguably one of the more important layers of protection that we have.